You're listening to the Beauty Beyond Bella podcast, powered by Formula Wellness.
Thank you for joining another episode. We're so excited to have you here and watch with us. This wouldn't be available if it wasn't for you. And so, as you know, I'm Dr. Yvette Suarez, board certified, and I have a fellowship in anti-aging and functional medicine, which is where my heart lies. Don't forget to like and subscribe and DM me if you have any questions. I am here with the wonderful Dr. Julie Shelley, and we're so happy to have her here. She owns Renew Aesthetics and Wellness Spa, and that is located in Oklahoma City. I am going to brag a little bit about her. She is my partner with Formula Wellness, and we actually co-lead the Wellness Clinical Board, and I'm so excited to have you here because there's so much going on, so welcome.
Thank you. I'm so excited to be here and dive right into it. There's a lot going on in our industry, and it's really exciting right now.
There really, really is. And look, what I love is we really have been the forefront, right? We've been leading this bioidentical hormones now for over a decade. And we finally got this black label warning off. Talk to me about what this, for the FDA, what is this going to mean for our patients and for your practice?
This is a huge win for women's health. Like you said, the FDA just lifted a black box warning on estrogen, which is huge for women's health because it finally allows women, hopefully, not to be so scared of estrogen and hormone replacement therapy. You and I have been prescribing bioidentical hormone replacement therapy for years. We've been doing it in our practice since we first opened almost 7 years ago. But I think it's really important to talk about why this black box warning was on estrogen in the first place, because it was really misleading for women. And I know you and I both over the years have had to really debunk a lot of myths for women. But where the black box warning started was back in a study called the Women's Health Initiative that was in the late 90s. And the studies came out in the early 2000s that basically showed that there was one arm of the study of women that was treated with a specific type of synthetic progestin and horse-derived estrogen that showed increased risk for breast cancer. And unfortunately, the FDA kind of just slapped this black box warning on all of estrogen, basically creating this warning for women. And it was really misleading and unfortunate for overall women's health. So to have that now lifted and have the conversation open and help women to feel more, confident in their decision to hopefully choose estrogen replacement therapy is really exciting for women's health.
I agree. What a disservice we have done for 20 years, right? That launched on 2005 when the hysteria started, and that fear-mongering has caused women not to have this treatment done. And I honestly feel bad not only for the millions of women that weren't able to do bioidentical hormones, but what about our colleagues who are so fearful and have actually told patients, don't do it. I mean, I'm sure you get it too. I still get it where when I put my patients on bioidentical hormones, I'm getting them coming back and saying, my doctor told me you're giving me cancer. And then I have to go through all the studies and show them. And I'm so happy to talk to your primary care. And you came from a primary care. You're board certified in both medicine and sports medicine. Tell me what that looks like in that world and then our world.
Absolutely. I was one of those physicians who 10 years ago would not touch hormones with the 10-foot pole because what we learned in medical school was the Women's Health Initiative. And we didn't get all the details on what it showed. We just were told, hormones are bad. Hormones can particularly lead to, increased risk of breast cancer and other bad things. And so to be honest with you, when I practiced just solely family medicine and women came in asking me for hormones, I did not recommend them for them. I was not a hormone fan. I thought all hormones were bad. I was kind of one of those women that just kind of had this misconception that, there's no benefit to hormones and the only thing that they could lead to were bad things. And so really it took me coming out of medical school and really attending a lot of functional medicine courses where I really learned what the study meant. I was really able to decipher out, the actual scientific evidence and learn about the importance of bioidentical hormones, which are a safe alternative to synthetic hormones. They're actually, as you know, derived from plants, so usually either soy or yam, and they don't come with any increased risk of breast cancer, heart attack, stroke, uterine cancer, anything like that. So that's what we've pretty much been almost exclusively recommending in our clinic for the last 7 years. But I have really done a full flip from not recommending them at all and really being scared of them to being a huge proponent and a huge advocate for hormones So I kind of understand where these primary care doctors and even OBGYNs come from, because really the training starts in medical school. You're just so misled to think that these things are bad. And you just kind of slap this, overall bad label on all hormones rather than really deciphering through the evidence. So it's really, really exciting to kind of have this label lifted, have the conversation open, and to help people know what is safe out there and what they can do safely and effectively.
Yeah, look, we all have to do our CMEs, right? In order to be a physician, you have to go in and, we have continuing medical education. It would be nice if we can almost force the conversation that they would need to take some kind of functional medicine courses. When you go through med school and you go through residency and now you're practicing, unfortunately, in the healthcare world, you have 7 minutes to see your patient, in, out, prescription, next patient, right? Where is that time that you can really sit back and understand a patient and maybe get them off their 20 medications they're on, right? We talked a little bit about why are all these patients on medications, and we're not looking to prevent disease. We're just treating the disease and then the side effects of all the medications we give our patients.
100%. You and I have had this conversation before, but I think it's so important to come at medicine from a preventative approach. And really, our healthcare system and our medical education isn't built for that right now. So when I did primary care, 10 years ago, and somebody would come into my office for any issue, they would leave my office with at least one, if not two or three different prescriptions. And I just wasn't trained to really come at it from a preventative approach. I mean, we always talked about diet and exercise and how important that was, but I wasn't really trained to know what type of exercise should women be doing, what type of diet should people be practicing. And so my practice has really dramatically changed to really focus on those pillars of lifestyle changes. And then I really look at hormones as just a natural medication, kind of like food is medicine. I mean, hormones are a really natural way to help with a lot of symptoms that women are having, particularly in this perimenopausal and menopausal transition in life. We know that a lot of things are happening from a hormonal standpoint. And a lot of the symptoms that we have are because of that. They're a direct result of, hormones being imbalanced. So if we can get those hormones in place, it's just been incredible to see how that can completely change a woman's life, how it can change how they feel, change their energy levels, change their confidence and their overall function. And of course, that's not to say that, certain medications are bad. Definitely certain medications are absolutely vital to overall health, but it's really, really creating those pillars and that foundation of overall health from a preventative standpoint that I think is so important.
Yeah, and I agree. Look, you mentioned both perimenopausal and menopausal. I think you have the same kind of issues when patients come in and say, well, I don't need hormones because I don't have any more periods. Or, my hot flashes are gone now. And they're not really looking at all the amazing things that we're going to get medically that it's going to improve, like osteoporosis, dementia, cardiovascular disease, Alzheimer's. So, I think it's important to take a walk back and actually start to talk about perimenopausal. And that's really the best time to actually start treatments, right? And not waiting till full menopause. Talk to me about how you're telling these patients and perimenopausal when they don't think they need it, that they really do.
I'm so passionate about perimenopausal medication, treatment for women. And typically what I will see is women probably in their late 30s, early 40s that will come to our clinic and they will say, I'm feeling, tired all the time. I have no libido. I have weight gain. I have this brain fog. I'm having sleep issues. I don't know what's going on. And I went to my primary care physician and they did labs and they told me everything was normal. I hear that multiple times every day. And I know you do too. And so we will do a much more detailed lab panel where we check hormones, where we check their cortisol levels, their insulin levels, a full thyroid panel, vitamin levels. We check so many different things to see really where the issues lie. And a lot of times we find out that these women are actually in the perimenopausal transition of life. And that is when it's really important to start hormone replacement therapy because it can help with the fatigue. It can help with the low libido. It can help with the sleep issues. And again, I look at hormones from during this time period as really being a natural alternative to medication. I think for a lot of these women, when they go to their primary care physicians for these same symptoms, they're told that their labs are normal, they're getting put on all kinds of anti-anxiety medications, antidepressant medications, which just have side effects. They can cause more weight gain. They can cause worse sexual side effects. And then they're just increasing the dose, and it's leading to kind of another cascade of issues. And again, not to say that antidepressants or anti-anxiety medications don't have a place. They absolutely do. But again, it's really important to treat the foundation of the issue, which can really be the hormone decline, and just balancing the hormones are going to make a huge impact on a lot of these females' lives.
Oh my God, I don't even think you realize, but you just talked about my biggest pet peeve. And that is, as soon as a woman hits menopause or has issues with hormones and they can't sleep and now they're crying and they're sad and they're depressed and they see their primary care, the first thing they do is give them an anti-anxiolytic and an antidepressant. And that really hurts my feelings because, again, we're increasing the risk of Alzheimer's and we're not treating the underlying condition, right? We're just throwing medications. And again, this is not to say that people that don't have severe depression may not need that, but it's not for our menopausal women that maybe only need a progesterone to help them sleep, right? And a little bit of estrogen to feel better and testosterone. And so it really hurts my feelings when they come in and now I have to work so hard because it's really hard to get them off of those medications once they're on. There's a large weaning process. You have to really make sure they're feeling great. And so I think that's wonderful. I think that we really need to educate these women out here that there is a better solution and a healthier solution.
Absolutely. And I have women too that will say, I'm doing all the same things I've always done. I have a lot of women that are eating healthy, that are going to the gym, and they're just saying, I'm doing all the same things that I've always done, but something's not right. I just don't feel like myself. I'm having this weight gain. And I think it's really important to get the message across that it's not just them. There are true biological changes that are happening in their body, which I think is so important to understand. And a lot of times getting on hormone replacement therapy, even if it's just progesterone, even if it's just testosterone cream, it can really change their lives and make them feel so much better, where they're a better spouse, they're a better mom, they're able to do things, activities that they've wanted to do. And, I'm sure you can agree that's sometimes the most fun part of our job, is seeing these women 3-4 months later when they've been started on these hormone replacement therapy medications and they just feel so much better. That's why we do what we do.
Yeah, I agree. Look, my favorite drug is testosterone. I always say if I can sprinkle a little bit on everyone, we would have a happier world, right?
I agree with you 100%. 100%.
Favorite drug. Look, when we're younger, if I went to the gym, it was really easy to, get lean and trim and feel like there was a change when I was in the gym. And then when you hit menopause, there is no change at that gym without testosterone, right? That testosterone is going to improve our lean body mass. And I've had so many women, where I feel like I've helped save their marriage because they say, you know what, I love my husband. I just don't want to have sex anymore. I have no interest at all. I do it because I have to. And we want to do it because we want to. And, it's just because they have no hormones. And I think they don't understand that there is a better alternative, that they can go back to where they felt more vibrant and more excited and had that more energy to be running around with their kids and be more intimate with their spouse. And they feel like they don't need that anymore.
Absolutely. Testosterone has saved, I think, so many relationships and so many marriages. And I think, again, prescribing testosterone and other hormones, we're not just making you feel better. We're really saving relationships. We're making you, again, a better spouse and a better mom, giving you more energy. So it's just, I think, incredible to, again, kind of have this conversation opened up and have these hormones, especially from a bioidentical standpoint, be a lot more mainstream. And I know you and I have kind of so far talked about the importance of starting these in perimenopause, which is 100% true. But I think it's also important for women who are actually in menopause, meaning they've stopped having periods, their bodies aren't producing estrogen anymore, to know the importance of hormones in menopause. Because I've had a lot of patients that come into my office just for other symptoms, maybe not feeling great. They might have a little bit of vaginal dryness. We might be talking about something else completely, like aesthetics, and just the conversation comes up and they'll tell me, well, I already went through menopause. maybe they went through menopause 5 years ago. And they say, well, I don't need hormones because, I'm not having hot flashes anymore. That part's over. And, I think it's important to know, once you're in menopause indefinitely. There's not a period where you're in it and then you're out of it. You're always in it. And so even if you're not having symptoms, we've talked a lot about the importance of these hormones to help treat symptoms. But there's also health benefit to hormones just from an overall health benefit standpoint. We know that hormone replacement therapy in menopause helps decrease the risk of Alzheimer's disease. It decreases the risk of cardiovascular disease, and it can actually help with bone density. So, as we go through the menopausal transition, we become a lot more at risk for something called osteoporosis, which is where we kind of have weakening and thinning of the bones. You talked about muscle building exercises in the gym. I think as women, we were always told that like cardio and aerobic exercise is assessed because we want to stay thin and we want to stay fit. But really in the menopausal transition of life, muscle building is so important because that's going to help protect our bones, protect us against fractures, and then ultimately protect us against death. So there's more to hormones than just feeling good. These actually have health benefits that are going to help us live longer, healthier lives.
And look, the number one reason women die is cardiovascular disease. And once you have a hip fracture, your risk of complications and mortality go up. And I think when you look at the studies, they're anywhere between 30 to 50% reduction of heart disease, right? Of dementia, of osteoporosis. And so what I look at is, why are we waiting for women to have osteopenia and then osteoporosis, then a hip fracture, and now we're trying to treat complications where if we just treat them with bioidentical hormones and decrease the risk of their bones being brittle, they're more likely not to break, right? I want to be that 80-year-old that is climbing Mount Everest. Okay, I'm afraid of heights, but let's say something crazy. I want to go hiking. I want to have a full life. I don't want to depend on something to move me around and walk really slowly and be afraid to do things because nobody took the time to treat me correctly right when I was younger.
Exactly. And I'm glad you mentioned being 80 because I literally just got a message on Instagram today by somebody that said, how old is too old to be on hormones? When do you want to stop hormone replacement therapy? And so I wanted to kind of ask your opinion on, when do you stop hormone replacement therapy on your patients? And is there ever a time that's right to stop, or do you keep going until you're done?
Look, I keep going forever. There was actually a really good study that showed once you stop bioidentical hormones, that 1 year, that first year after you stop, your increased risk of mortality skyrockets up. So I look at that like this is something to help with longevity of life. There's never a time that you want to say, okay, I don't want to stop. I don't want to start living anymore. I'm good. Like I'm ready to pass away. Like I don't hear anybody say that. They just think that you can just stop and be healthy. And again, they might not need as many hormones, and I also may change what type, right? I'm not likely to do a pellet in an 80-year-old. I'm more likely to do a cream, right? I just want to help them not have all of this disease process, but not necessarily trying to make them feel like they're 30 again.
Exactly. And I feel the same way. We will treat patients with hormones until their very last day. There's no evidence to show us that there's a reason why we need to stop. And I think you brought up a really good point in terms of pellets and the type of hormones that they're going to get. Talk a little bit about the different type of, modalities in which we can get hormones and what you all do in your practice.
Look at that. Dr. Shelley's putting me on the spot here.
Now I'm asking the question.
We're very similar, right? I do like all three. I like pellets a lot. And then I do a lot of sub-Q injections for women and IM injections for men. And I also do creams. I will say creams are my least favorite for young people. I do feel it's a little bit harder to absorb. It's a little bit harder to get higher levels that we want to feel great. So I kind of look at what their age group is. I also look at what their fear is, if they're afraid of needles. And also, like, we have a lot of people that work and travel a lot, and pellets are really easy that they can come in every 4 months. So depending on their lifestyle, depending on their age, depending on their fear factor, which has been going on for 20 years now, will really cater to me. But I think you and I both probably are still very pellet and injection form. I want it in. I want them feeling amazing in 6 weeks. I don't want to wait 3 to 6 months for them to feel like they're getting what they need.
Yes. And we do the same thing in our practice. And again, I think that's really important for women to know is that there are different modalities that we can use for hormone replacement therapy. And we can always kind of start more conservatively and then be more aggressive if we need to. So we do, we offer the same options in our clinic. We offer creams, we offer oral types of hormones, and there are bioidentical oral forms. We offer injections, we offer pellets. And so there's no wrong way to go, right? I mean, our goal is always to help patients feel the best, to be the best functioning, people that they can be. And so if we have somebody younger that might be scared about pellets, and what pellets are is they look like a little pellet. They're a little bit smaller than a Tic Tac. We place it underneath the subcutaneous tissue, and it in women dissolves after about 3 to 4 months. So you're coming in about every 3 to 4 months to get those pellets. And they're extremely beneficial for women who are really, really depleted of their hormones, because we can give kind of the best, systematic, decrease in their symptoms, help them feel the best. But it's not for everybody, right? And I think that's where you really want to choose a provider that has multiple options. It's not a one size fits all for women. It depends on your age. It depends on what your symptoms are, what your levels are, what's your height, your weight, your activity levels. I think you and I really, really dive into that with our patients and really give a customized approach. And I think, really when you're choosing a provider as a patient, it's important to look at the different modalities that provider offers, because there are certain providers that might just offer one type, and that might not be the best type for you. So I think opening up the conversation to know that there are multiple modalities of how to get these hormones is really, really important, because we want to do what's best for our patients and helps them feel the best, but also be the most comfortable.
Yeah, I 100% agree. Look, having that multiple things, people get stuck on one and they always like, which one do I have to have? And I go, it really depends. Let's have a conversation about what's going to be the best fit for you, right? I don't want to ever force someone to have something that they don't want, right? It really needs to be their best choice. I think that is so, so important. So talk to me a little bit about, symptoms. I think for me, brain fog was my biggest issue. And we used to have this running joke when I used to do pellets that I would have this writing board. And so I would write all my notes. And then when my pellets would kick in, I would like, why do we have this bulletin board in my room? Get it out. And then, a few months later, I realized, oh my God, like I can't remember things. And I would start writing notes again. And then one of my staff members looked at me one day and go, that's because your testosterone is low. And I started laughing hysterically. I'm like, all right, take the board out and give me my pellets. And so I think that brain fog, there's so many things that can cause us to feel out of whack. But I think people don't think about hormones when they're just fatigued and just not with it all the time, or going to the closet and not remembering what you're going to pull out. That, women happen all the time during perimenopause.
Absolutely. I think people just think it's normal. It's part of the aging process. And while it is common and normal, it doesn't have to be your normal. There are so many things that we can do to help with those symptoms, and hormone replacement therapy is one of them. But I also don't want females to think that it's only hormones that we have to really help with these symptoms. I think you and I do a lot of peptide therapy. We do a lot of nutraceuticals to help with these things. So I think it's really important to know that a comprehensive approach to these symptoms is best. While yes, hormone replacement therapy is going to kind of be the building block or the main ingredient in the recipe, there are things like NAD, like glutathione. There are, peptides that we can use like ipamorelin, testosterone, that help women overall with their symptoms. We can help give peptides that are great for improving muscle mass. We can give peptides that are great for, gut health. And I think gut health is so important in all of this too. We haven't addressed that yet, but hormones and gut and, overall mood are so interrelated that it's my belief that you really can't treat one without the other, right? We can give you hormones, but if your gut is out of whack or you have leaky gut, you're not going to get the best results that you want to see. So we also, need to take accountability as women that we need to really incorporate those lifestyle changes into our overall vision of health as well. So making sure that we're eating low inflammatory foods, that we're getting our fiber, that we're getting our water. Also sleep is a really, really important pillar to everything. I mean, I always say, if you're not eating well and you're not sleeping well, we can give you all these things, but it's not going to make the impact that we really want it to make if you're not really just, abiding by the basic building blocks. So I think it's really important to address the importance of those things. As adults, we need to be getting at least 7 to 9 hours of sleep, which might sound like a lot for a lot of people, but and I'm the same way. I'm at least 7 to 8 hours, at night per person. Sleep is super important to me. And I can tell, if I don't get my sleep, going back to the brain fog and the forgetfulness, and just the low energy, I can really feel that the next day. And so we've got to be addressing all of these things in the overall picture of female health. But again, all of these things are really, really important to discuss with our patients.
Look, you said so many wonderful things, and I'm going to kind of walk us back because I want to kind of dive a little bit into peptides. I want to dive a little bit into nutraceuticals. I want to dive a little bit into lab work, right? And the fact that, for example, vitamin D is one of my favorite vitamins. I truly believe in ADK, and we're going to talk a little bit of the difference between D3 and K2 drive. But for example, like vitamin D, there is a chart that says normal is between 30 and 100. So I always tell people, what do you want to be, a 20-year-old or a 100-year-old, right? Where is that you want to lay? And understanding that functional medicine is maybe at that 75, 80% chart, right? We don't want to be at 30. That is very low, right? That is low for immune disease processes. We know now with studies show that if it was during COVID time and you were less than 40, you had a much higher risk of disease and dying from the disease process. And so nutraceuticals to me is so important. And I tell people there is some pill fatigue, but I probably take about 10 pills a day. And it's so important. We lack nutrition in our food and we lack vitamin support. And so I always want people to understand that vitamins are important and a medical brand is important because the ones over the counter may not be methylated. They might not have K2 drive. And so talk to me a little bit about what you're telling your patients about nutraceuticals and how that kind of influences their path.
Absolutely. My number one rule is do not buy your nutraceuticals on Amazon. I think there was a recent study that showed that 70% of supplements sold on Amazon had no clinical benefit because these supplements are not FDA regulated. They're not, regulated by a compounding pharmacy. You don't know that what they say is in it is actually in them. So my two rules on Amazon are don't buy your skincare and don't buy your nutraceuticals or your supplements on Amazon. Trust me, there are a lot of things I buy on Amazon every day. I feel like there's a package at my door, but those are not any of them. And then I'm glad you mentioned, how many supplements you take. I recommend for all of my patients, buy an actual, pill box and put all your pills in all the day, in all the days. And I will have patients say, oh my gosh, I feel like my grandparents, or I feel like my parents, I feel so old. And I said, but this is what helps keep you young. So you've got to be taking these things. But absolutely back to your point about, vitamin D and optimizing a lot of these lab values. We want patients to feel the best. And a lot of times it's kind of being on the upper range in terms of levels in the blood on a lot of these vitamins, vitamin D, vitamin B12, magnesium. Are really important. So I absolutely will recommend nutraceuticals and supplements in addition to your hormone journey. I'm a big fan of probiotics for gut health, just to keep the good bacteria in the gut and let the bad bacteria out. I love vitamin D. We'll talk a little bit about the importance of that, but it's great for bone health. It's also great for cognition. It helps you feel better. It's great for a lot of other things. And I am also a fan of ADK, getting that vitamin A and K2 into, your vitamin D to really help drive it into the bones. Magnesium is a hugely important supplement. I believe it's still the number one nutrient deficiency in the United States. So I take a magnesium every night before I go to bed. And then I also take DIM, diindolylmethane, which is a really important ingredient to also help with hormone balance. So again, and I love that we're opening this conversation of just this whole picture of holistic health. And at the end of the day, I think that's what you and I both practice, is this holistic health. We're not just tunnel visioned on one thing like hormones or, whatever it might be. It's really important to make sure we're addressing everything. And the lab values will really kind of help guide us to know where a lot of those deficiencies are in patients. So again, that's where I believe it's really important to get a really thorough blood panel. I think our lab results are like 8 or 9 pages versus when I practice primary care, it'd be 1 or 2 pages. And honestly, as primary care docs, we're just screening things, right? We really don't want to find anything because we don't have enough time with patients, to go over all their results or call them back. And so I think what we do now, sort of in this functional medicine space, this aesthetics and wellness space, allows us to have more time with our patients and really treat them in a holistic way like they deserve to be treated.
Yeah. Amen. All of that. I mean, want to tell you how many, but I agree with you. I'm on magnesium. I'm on iron. I'm on DIM, right? I'm on B vitamins, methylated B vitamins. I'm on thyroid support. Like there's just vitamin D. There's so many things. And so again, I think looking at us, the healthier you are, the more that you should be on vitamins, because my goal is that pill box never becomes a prescription medication that requires me to survive. This is to help me prevent any further disease processes, which is going to be so important.
Exactly.
So am I using peptides?
Okay, yeah, I was just going to say, I think kind of the other important thing that I'd love to talk about, because it's such a hot topic right now, is GLP-1 medications. GLP-1 medications are a peptide. So what are peptides? Peptides are chains of amino acids, so kind of short chain proteins that are naturally found in the body. We're just giving you these peptides at basically a higher dose. The GLP-1 medications are typically given as a once-a-week injection, although we often will do smaller doses for patients twice a week too. But I'd love to kind of talk a little bit about some of the myths of GLP-1 medications, what you hear from your patients, and kind of what your take is on what we feel like these GLP-1 medications can really do for patients.
Yeah, look, I before I wasn't really fond of a lot of weight loss drugs, but I feel like the GLP-1 is not necessarily only a weight loss drug, because it really is improving so many things that we think are important. It's decreasing our visceral fat, which is that internal bad fat that can cause heart disease. We're decreasing insulin resistance. And so, yes, at higher doses, we're really pushing more for weight loss. But I really love microdosing. I think keeping down the inflammation in our body, keeping down our little appetite, our little food chatter in our brain. And there's so many great things. And so there's no woman that doesn't want decreased waistline, right? And some of that comes from internal, not only fixable fat. So I actually love microdosing. That's like one of my favorite things. And so a lot of us do that at our practice.
Absolutely. And I'm glad you brought up inflammation, because really, as we age, inflammation is the bad guy. Inflammation increases insulin resistance in the body. It really puts a damper on hormones. It really decreases our immune system. It affects our gut health. It leads to so many things. And as we age, that inflammation rises. And there are lots of reasons why that happens. But, also as we approach menopause, our bodies as women become a lot more insulin resistant. And so I'm glad you brought up the microdosing, because GLP-1 medications can be, a hugely important treatment for helping reverse that insulin resistance, help you become a lot more insulin sensitive, and really just help your body function the best. But exactly like you said, we microdose a lot of patients on these GLP-1 medications. And for those who don't know what microdosing basically just means we're giving smaller doses of the medication than the smallest dose of the pharmaceutical brand, right? So for example, for tirzepatide, at the smallest dose of the pharmaceutical version is 2.5 milligrams. We might give, 2 milligrams or 1.5, or we might give 1 milligram twice a week. And that can be really important for females as well. But we know with these GLP, there are actually a lot more benefits to them than just weight loss. So recent studies have shown that they might decrease the risk of breast cancer, which is huge, might decrease the risk of cardiovascular disease, of Alzheimer's disease. Obviously, like we talked about, they help with insulin resistance. We actually have several patients that have been sent by an oncologist to us because of their anti-inflammatory effects. We know that obviously cancer is so inflammatory, and a lot of the treatments that people have are so inflammatory. So we actually microdose a lot of oncology patients. We see off-label a lot of autoimmune patients, that obviously have a lot of inflammation in their bodies. But it's been amazing to see a lot of women using these GLPs kind of off-label that just have noticed such an improvement in their overall inflammation in the body and how they feel overall. They might not even need it for weight loss, but they just use it because it helps them feel better. It helps with their joint pain. So we oftentimes will use these GLP-1s, even in a microdosing format, in combination with our hormone replacement therapy, in combination with our peptides, and they've been hugely beneficial. I think that where we really want to be cautious is how we're educating our patients on these GLP-1 medications. So I think one of the things that I always caution my patients about, particularly if they're using GLPs for weight loss, is we've got to monitor your muscle mass while you're on these medications. And so I think you have a device in your clinic as well. We do in ours, where we have the ability to really measure patients' body fat and muscle mass.
So excited to have you here watching and joining our podcast. It really means the world to me. And I really want to thank you and also thank our sponsor, Formula Wellness. As you know, I am Dr. Yvette Suarez. I'm a board certified physician, and I have a fellowship in anti-aging and functional medicine. So please like and subscribe and DM me if you have any questions.
So now when patients come in, we will automatically have them do, it's called a Sika scan, where we monitor their body fat and their muscle mass, and we will kind of watch that as the patients progress. We know that GLPs, if you lose too much weight, they can also burn through muscle mass, which we don't want to happen. So that's, again, where it's really important to incorporate things like testosterone. There are other peptides that are muscle-building peptides that we can recommend for women. It's really important to educate on the importance of protein and how much protein you should have in your diet. I'm a huge fan of creatine. I actually take creatine every morning, about 5 grams, in whatever I'm drinking that morning to really help me with my muscle mass. And then we have other muscle building devices in our clinic. We have M-Sculpt Neo, which is an incredible device for overall muscle building. It also helps burn fat. But for patients who really aren't able to do what they want to do in the gym, whether it's time, whether it's, injury, or whether it's just, hard for them to actually do it, all of those things can be really beneficial in helping build muscle mass for patients, particularly females, and then obviously long-term decreasing the risk of osteoporosis, which of course is the ultimate goal.
Yeah, I agree. I love the combination of testosterone and some of the other peptides, right, to kind of help increase muscle. But we have that conversation with women all the time, including myself. It's really hard to get enough protein a day as a woman. And so I had my protein shake this morning. It has to be a thought out process. Like, we can't just go through the day and fast like we used to do. I feel like when I was younger, doing intermittent fasting was great. But after menopause, that does not work for me anymore. I need to really make sure that I'm protecting my bones and my muscles. So having enough protein, eating enough during the day is a struggle for me because it's a change, right? I have to make sure I get enough protein. And there was actually a really interesting short study that just came out that showed, because anecdotally, when you take GLP-1s, your alcohol taste goes away and you don't really crave alcohol. And so they're now doing studies on how this may be in the future some treatment for alcoholism, which would be really amazing. I love the fact that it does something. You have no interest in drinking alcohol. So look, I really haven't seen any bad things with this drug right now. I think in the beginning, there's some people that way overdose. And like you said, I think keeping appropriate dosing for our patients to make sure that they're losing weight safely, that they're not losing muscle mass. And then that is a conversation. That's why we see them every single month for a Sika evaluation. We want to know what they're doing. We're not looking, I tell people all the time, we're not looking for you to lose 50 pounds in a month. That's unrealistic and unhealthy, right? Because people want it yesterday. And it needs to be a slow process that makes sure that you stay healthy and optimal at all times.
Absolutely. I 100% agree. And I think there are so many kind of myths about these GLP-1 medications. And that's where I feel very strongly that it's important to really see a provider who's monitoring you throughout the journey, who's also educating you on what you need to be eating. You mentioned the importance of protein, which is hugely important for females on these medications. Fiber is extremely important. Water intake is extremely important. Still making sure that you're getting your nutrients in with your diet is important, because I think one of the myths I hear all the time from patients is that they think GLP-1s are just supposed to make you not eat. And really, calorie restriction is not good on these medications. You need to be eating. If you're calorie restricted, your metabolism shuts down and then you're not burning fat on your own. And so it's really important to still make sure you're getting adequate calories. It's just making sure you're getting the appropriate calories, right, through your protein. And protein shakes are a great way to get your protein intake with these medications. I'm a huge fan of protein shakes, and we'll often recommend that for our patients. But just making sure you're getting the adequate calories and the adequate nutrients, because I think that when women aren't educated on those types of dietary needs on the medications, that's when we start to see a lot of those side effects, like, hair loss, like muscle mass loss, like the nausea, the constipation. There can be side effects on these medications. And the key is really just being educated on what you need to be doing diet-wise and exercise-wise to really keep those side effects down, and then really to help you long-term with weight loss. Which kind of brings up a good point in terms of how do you titrate your patients off of GLP-1 medications, or do you have some people that might kind of be on these medicines indefinitely?
Yeah, that's a hard one. And we really have learned over the last few years that as I start to titrate them, I'll normally go to 10 days, I'll normally go 14 days. I feel like once we get up to about 21 days, that food chatter starts to go up and our weight starts to creep back up. And so, and I've done this, right? I've been on and off and gaining the weight back, and it really is frustrating. I almost find that either microdosing or at least a dose once a month or once every 3 weeks has really maintained that they don't gain any of the weight back. Their inflammation still comes down. And so, and I hate to say it's a medication that you might want to be on forever because nobody wants to be on anything forever. But I will say personally, I love having a little bit every once in a while. It really feels like it just keeps everything in proportion and I feel much better on it. And so do my patients. So, at some point we like to be off of this, but I mean, everyone feels better on it.
I agree. I know you do aesthetics in your practice as well. We do as well. Kind of talk to me a little bit about what you've seen from an aesthetic standpoint for women that have been on the GLP-1 medications, who have lost GLP-1 medications, because I'd love to kind of talk about aesthetically things that we can do to help prevent the, Ozempic face or Ozempic side. How do you kind of like to pair these in your practice with a lot of the aesthetic treatments that we're able to offer?
Look, and women always want to wait. They always tell me, I don't want to do any aesthetics until all of my weight is gone. Well, then it's too late, right? And so I always tell people about every 20 pounds, you need to come in and get something done. So whether it's an HA filler to kind of improve your cheek volume so you don't look really saggy, whether it's some biostimulators like, Hypodilu Radiesse or Sculptra, those work really well. I think if you wait too long and everything is hanging, it takes us a lot more time and effort and cost to get you to feel and look great again versus a little bit throughout your journey, I think goes a long way. And I'm guessing that you feel the same way.
Absolutely. And I mean, we're seeing this big trend. I don't know if you all are in Florida too. I'm sure you actually saw it before we did in Oklahoma, but we're seeing this big trend for people aesthetically wanting to do kind of more natural treatments. And so I'm glad you brought up Sculptra because that's one of our favorite treatments to do for patients who are on these GLP-1 medications. Sculptra is a biostimulator, so it's really naturally helping your own body produce collagen and elastin, and it does help fill in some volume loss, which is obviously happening as we lose weight. I always tell females fat is the one place, the one place we want it is in our face because it helps keep us looking younger. So we want to help maintain that volume. And we know that with weight loss of any kind, whether it's with GLP-1 medications or just diet and exercise, you can lose a lot of that volume. And so it's really important to start early. If you know you're going to lose weight, let's start the volume, restoration process now. And so Sculptra takes 5-6 weeks before you start to see the results. And typically multiple treatments are needed. So I always say, let's start your Sculptra journey, or your HA filler journey kind of while you're on these GLP-1 medications. You don't want to wait till the very end when you've lost collagen and elastin, because then we're just working harder to kind of, try to catch up with all that volume that's been lost. But Sculptra, I think, has been one of the most beautiful treatments that we've had aesthetically to help with GLP-1 medications. And we actually do a lot of it in the booty too. So we do Sculptra and in the gluteal area and to kind of help build at the volume loss that happens with weight loss too. And then we've also liked to pair it a lot with, we have a device called N-Face, which really stimulates the tightening of muscles in the face. So it kind of helps lift everything up. So we like to pair that in addition with our Sculptra and then with our HA fillers as well. And I think, you and I have kind of talked a lot about what we're seeing in our practice with HA fillers, HA being hyaluronic acid filler. And, I think our industry for a long time, unfortunately, did a disservice to women where we overfilled. And there's these terms like pillow face that have come up. People will come into my clinic and just say, oh, my husband's so scared I'm going to look like so-and-so down the street. And I think that we as an industry, not you and I, obviously, but as an industry, overfilled patients. And I think injectors just didn't know when to say no. And I think the key is really making sure that you're going to the right provider who understands facial anatomy, who's doing a full facial assessment, who knows when they're injecting these fillers, what plane of the tissue we're injecting in, how we're doing it with needle, with cannula, what product we're using, and just knowing when to stop, when the right amount is. And again, we also, if people don't want filler and they want to do things that are completely natural, we have the ability to do that now with a lot of our regenerative injectables, Sculptra being one of them for us, N-Face being one of them. But I still think there's no substitution for HA filler when it comes to the lips, when it comes to building out a jawline or a chin. Those are still some of the best tools that we have in our tool belt from a non-surgical facial augmentation standpoint. So, I think what those syringes can do in our hand is still unbelievable.
So look, this has been such an amazing conversation. I feel like there is so much we still need to educate everyone on. And I think when our audience starts to watch this video, they're going to really have a wealth of knowledge. And so I definitely agree, Dr. Shelley, you're going to have to come back again. We're going to have to do a number 2 podcast because I think this is really important. I think we didn't really get to dive into the aesthetics. We didn't really get to dive into men and bioidentical hormones and peptides. And that is so important. That's a whole different conversation that we need to have gone. So I think everyone's going to agree that we need to have you come back and we're going to continue this conversation because I just love having this with you. So I'm going to give you our final question as we need to kind of conclude today. And that is, what does beauty mean to you?
Beauty to me means feeling confident from the inside out and the outside in. And I don't think those two things are mutually exclusive. And I think that's one of the reasons why in our office, and I know in your office, we do both wellness and aesthetics. I think when people feel better from the inside and we're decreasing their inflammation and helping their body function the best, you can see it on the outside, right? Their skin looks better, their cells are better, the health of their, overall external appearance is better, but also treating from the outside in. We have so many patients that have had tough times in their lives. They've gone through a divorce, they've gone through a death. They just haven't been taking care of themselves. And you can see it in their outside appearance. And when you're able to give them that beautiful aesthetic treatment and restore their confidence from the outside, then they also start to feel better on the inside. So being able to really treat people from the inside out and the outside in, to me, is kind of that full picture of beauty. And ultimately, we just want our patients to feel confident in our own skin. And that's how we do it in our practice.
I love that. I completely agree. And inside out. And I always tell people it's much easier for me to make you look good on the outside, right? Injectively, we can do that talentedly. However, to make you feel good on the inside, it's a process and a journey that we take together, right? I can't just tell you what to eat and how to exercise and what nutraceuticals. This is a process that we work on together as a journey. And I think that always makes our patients and us really connected and continue to grow our practice together.
Absolutely. And just making sure you're surrounding yourself also with those that are supportive of you, I think is really important. Making sure that your tribe and your community is loving and supportive. And so that's how I feel about you. I'm glad to have you in my tribe. And I am absolutely here for part 2 of the podcast at your port. So you just let me know when. You got it. Love you, girl. Thanks, you right. Love you, Dr. Suarez. Thanks so much for having me on.
Powered by Formula Wellness.